Nice that you're both here, two clinicians with a heart for technology.
Yep.
And I would like to ask you guys, can you please both share your perspective on how technology actually contributes to the daily work of a clinician?
I think the wonderful thing about implementing AI in clinical work is that it's bringing back the joy of being a physician, because you're actually doing more of the tasks that you're enjoying, like talking to your patients, being able to not focus on the documenting part. That's a burden. That's not what you went to med school for. So being able to connect on a human level and engage in the talk without any concern about writing down the stuff, that brings another insight into that relationship between a doctor and a patient. So I've been missing that. And I also realized that our patients haven't been honest with us. I don't think they have enjoyed the conversations the last couple of decades that we're having with them. But now it's bringing back the natural relationship as it should be between a doctor and a patient, being able to fully be focused on the patient and what they need. So it's that's just one way to look at it. So it's basically enhancing the human part of the interaction.
And are you able to provide better care because of that?
Definitely. So I know that people are interested in the numbers, like how much time are you saving, how much money are you gaining from this, or what are the results? And I think it might take some time to see these changes, like these significant changes, but you can feel it as a patient, but also as a physician. You can feel that the conversations are, that the impact is greater. So I think even if you don't see it in the numbers yet, I think you definitely feel it. The burnout is less. I think that you will see it. A lot of physicians will tell you this. So it's not just anecdotal. It is showing up in the numbers. Like small numbers now, it will grow.
Yeah, nice. Thanks. And how is that for you, Dr. Talat?
Yes, I would agree that this is the future of medicine, to use the digital technology to the advantage of the care that we're providing for the patient, but also the well-being of the clinician, because rested, happy, comfortable doctors are also, or healthcare providers are also a good thing. And so I find, in a practical sense, definitely it has increased my ability to provide holistic care, because it is good to have the nonverbal cues and to be present more. And the other thing we're noticing is we've started an AI summary. So that means that before I bring in a patient, I'm able to get a really big picture view and some important parts of the journey, and to be able to not go, looking as Sherlock Holmes through the entire patient electronic medical system. So I think it really has brought out that ability to provide personalized care. And also we are using the AI to create an action plan for the patient. So it's able to then tease out the parts that are more relevant to the patient and create that almost like a little bit of homework or a little bit of support for the patient going home. Because we know that not always do the women remember a lot of what has been discussed. So it's our duty to support them better with tools that will be, able to make them have, the shared decision making that we want them to have.
This is very inspiring, and I think it speaks to the mind. But for those who are very focused on the numbers, we had a conversation just before this interview that about time saving on a day. How because you're still practicing as a clinician. What's your experience now? How technology helps you?
Of technology is that it's saving me at least an hour a day. And it's not only the time that it's saving, it's the quality, because it's the timeliness. So for example, if your letter to your referring practitioner is ready right there before the patient has left our doors of our practice, I think that is that's good care. You know what I mean? So it's enabling not only the time that we're saving, but actually the quality, the timeliness of the documentation for the patient.
Thank you very much.
Thank you.
Thank you.